New York City health officials say a person has tested positive for the family of viruses associated with monkeypox. The patient is isolating as they await further confirmation from the CDC. It would be the second case of the rare disease in the U.S. this year. Dozens have been confirmed around the world. On his way to Tokyo, President Biden was asked if he's concerned that this could become a larger issue.
It is something that everybody should be concerned about. We're working on it hard, figure out what we do and what vaccine, if any, may be available for it. But it is a concern in the sense that if it were to spread, it's consequential.
Dr. William Schaffner joins me now. He is a professor of infectious diseases at Vanderbilt University Medical Center. Dr. Schaffner, good to have you back on the show. So for viewers who think that this sounds eerily familiar to the early days of the COVID-19 pandemic, what do you say?
I would say, with respect to the president, I wouldn't say everyone should be concerned about this, interested for sure. And that's because monkeypox does not spread the way COVID does. It spreads slowly. It requires really close and rather prolonged personal contact in order to spread. We talk about a chain of transmission. I have it. I have close personal contact with someone else. They get it. They in turn give it to one or two other people. So public health around the world, in Europe, Canada, and here in the United States, are contacting everyone who's had close contact with a case, putting them under surveillance. And I think, although there'll be a few more cases discovered, I think public health will be able to contain this epidemic rather quickly within the next week or so. That's my anticipation.
That's an important fact check for us. You say that it's very different in terms of how it spreads from person to person than COVID-19, which we later learned was airborne. What should somebody do who's potentially exposed to monkeypox? Should they quarantine? Any guidance on that?
Well, at the moment, there's no guidance that you should quarantine yourself, but you should certainly remain alert. Should you develop a fever, feeling badly, swollen lymph glands, immediately call your healthcare provider. Of course, tell them that you think you were exposed so that they can, at that point, isolate you, because then you're just starting to become infectious to others.
Well, we are still dealing with COVID-19 after more than 2 years. How does the ongoing pandemic impact our ability to respond to other outbreaks, whether it's monkeypox or something else?
Well, fortunately, we have a resourceful public health network out there. Monkeypox was discovered very quickly, not only here in the United States, but in Canada and in Europe. These patients were identified. We communicated with the medical personnel, all the doctors in those countries, so we're on the lookout for more cases. Public health continues to have the capacity to respond promptly and appropriately.
Dr. Schaffner, I also read that monkeypox and the family of viruses that it's related to, smallpox and the like, are very different from COVID-19. I'm going to just hammer this a little bit because I think people right now are so stressed by the pandemic that they want answers about this and they want to know whether or not they're afraid. And I read that it doesn't have the same potential to mutate as COVID-19. Can you talk to us about that? And then also about the ability to vaccinate people should it become something that is necessary here in the U.S.?
Well, just because they're both viruses does not mean that they behave the same way. COVID and monkeypox behave in very different ways. As I say, monkeypox really is spread quite slowly, carefully from person to person. You don't have generally large outbreaks of monkeypox in populations. Number two, we can identify monkeypox very quickly because of its distinctive rash, and we can treat these patients if we have to. The other thing is, the old smallpox vaccine that we used to use, well, it provides some measure of protection against monkeypox, but we're not contemplating a large-scale vaccination campaign at the moment. That would require a whole lot of planning and some special training, but it's there on the shelf. if we need it.
That's good to know. Dr. William Schaffner, you always keep us calm and give us the facts. Appreciate you and all that you do.
My pleasure.